For the last several years, my research has focused on environmental justice, public participation in science, and public trust. Today I'm going to talk to you about trust. Trust is foundational to all of our relationships. Our work and family relationships, our romantic partnerships, our friendships, even the relationship we have with our doctor or mechanic. It would be an understatement to say the last several years could be characterized by lack of trust. Studies show trust is declining, interpersonally and in our social institutions. Government, science, medicine, education, each of these has been subject of intense public debate and scrutiny over the last several years. This debate and scrutiny isn't really new, nor is it necessarily unwarranted. Because trust is so foundational to all of our relationships, whether personal or societal, trust must be earned. Today I'm going to talk to you about trust, specifically trust in science. I'll explore how we lost it and some things we can do to get it back. Some of our mistrust in science comes from the fact that our modern lives require us to have faith in scientific and technological advancements that few of us have the expertise to fully understand. Sheila Jasanoff is a distinguished professor of science and technology studies at Harvard. She puts it this way: there is hardly a step we take in the course of an ordinary day without in some way counting on the wisdom of people we never see, whose names remain hidden, whose judgment is never publicly questioned except in times of crisis or breakdown. Every time we rely on a traffic signal, get on a plane, or give a child medicine, we're relying on the judgment and virtue of anonymous experts. What have they done to deserve our trust, and what have we done to ensure their accountability? From the moment we wake, we rely on expert knowledge to order, regulate, and secure our lives. Most of the time, most of us trust these experts. So what happens to make this trust break down? Sometimes science is wrong, or misused, or distorted. It feels a little blasphemous to be here in an institution of higher learning today and say those things. But we have to be honest if we're going to restore trust in science. Science is fallible. It's true most of the time. The planes land safely, the medicine heals our loved ones, the stoplights work. But that's not always the case. And we know from social psychology that negative outcomes and negative examples are most likely to stick in our minds. Therefore, they must be addressed. Sometimes, science is used to deliberately mislead the public. Corporations and special interests have the means to generate their own scientific findings if a consensus emerges that perhaps they find inconvenient. Science does not occur in a vacuum. Science is not always pure, but it is always potentially political. No one wants to be in a relationship with a person who feels they're above reproach or won't be held accountable for their actions. The same is true for our scientific institutions. Trust needs to start with honesty and accountability. Sometimes science's failures are moral. In the Tuskegee experiment, a known cure was withheld from patients simply to watch their disease progress. That is a moral failing. It is a moral failing to use a person's biological material for ongoing research without their consent, as in the case of Henrietta Lacks. Exploiting people who are incarcerated or targeting communities of color or low-income white communities for scientific or medical research is a moral failing. We have to address these issues if we are going to restore our trust in science. Sometimes science's failures are technical. In the aftermath of the Chernobyl nuclear disaster, amidst fears a cloud of radiation was spreading across Europe, British government and scientific authorities issued a series of restrictions on the movement and sale of sheep in the county Cumbria. Naturally, this caused great hardship for farmers. Ongoing scientific uncertainty related to ignorance of local environmental conditions caused these restrictions to be extended again and again. Eventually, it was revealed the scientific basis for those restrictions was wrong. There was a problem with radiation in the county, but it related to a British nuclear facility. It had nothing to do with Chernobyl. And the real kicker was that local people had been complaining for years about illnesses related to that very facility and had been ignored by scientific and government experts. Sometimes moral and technical failures collide. Residents of Flint, Michigan struggled for over a year to draw attention to their health and safety concerns when the water supply was switched from the Detroit River to the Flint River. They were assured time and again by local and state officials that the water was safe to drink. Even President Obama famously staged a photo op drinking Flint water. But the residents knew something was wrong. They could see, touch, taste, and feel it. Their hair was falling out. Their children developed rashes. Their water was brown. By the time Flint's water crisis was addressed, children had been exposed to lead contamination for 18 months. The official death toll in the Flint water crisis is 12, but epidemiologists now estimate the real death toll is over 100 because waterborne illnesses like Legionnaire's disease were not tested for and remain unaccounted for in the official statistics. These examples show that we can't simply insist people trust the science. There are good reasons for people to be skeptical. And just insisting people trust the science ignores the real and complicated reasons why some publics may or may not believe data presented to them by authorities. It's true, most of the time, science works in our favor. Vaccines have eradicated many illnesses that were once deadly. Millions of people fly safely every day, and more people have access to clean, safe drinking water than ever before. So how do we balance unexamined rejection of scientific claims with unquestioned faith in scientific institutions? How do we restore trust in science? One way to do this is through public partnership in science, sometimes called citizen science or community science. When non-professionals pair in scientific investigation with scientific professionals, trust can be restored, wrongs can be righted, and justice brought to communities. It was just such a partnership that eventually brought justice to the Flint community when Virginia Tech researchers paired with Flint residents to independently test the water. It was these data that finally were taken seriously and got Flint the attention it needed and deserved. These partnerships are not uncommon. Across the country and around the world, hundreds, maybe thousands of such partnerships currently exist, where scientists and community members are working together to address environmental justice concerns. Another example is the Louisiana Bucket Brigade. In the lab partnership, scientific experts pair with residents of Cancer Alley to build simple, effective air quality monitoring devices out of 5-gallon buckets and a few other supplies. Cancer Alley refers to an 85-mile stretch along the Mississippi River with a disproportionate amount of oil and gas refineries. Also called the Chemical Corridor, these refineries are located in or adjacent to historically Black communities. Residents of these communities have complained for decades of respiratory illnesses, cancers, and other health concerns related to emissions from the refineries. The refineries insist their emissions fall within EPA guidelines. Therefore, they're not causing harm to community members. The bucket system allows residents to test air quality when they suspect a flare-up, rather than simply relying on corporate-produced data. Lab-produced data has been used for corporate accountability, even resulting in buyouts for some neighborhoods. Here locally, I'm collaborating with a group of people both at Coastal Carolina University, Furman University, and Duke University, where faculty, staff, and students have been working with the Bucksport community here locally. Bucksport is a historically Black community here in our local area that is vulnerable to flooding and other environmental justice concerns. Following the leadership of Bucksport residents, this research collaboration has resulted in data on housing, flooding, hydrology, and other environmental justice concerns. And the community has been able to mobilize that data so far to win tens of thousands of dollars in grant money to build community improvements. And it's a young partnership. It's just about a year old. There's a lot more work that can be done here. Despite these positive examples, questions about power, control, and accountability remain. In Flint, for example, some residents began to feel that the Virginia Tech researchers were speaking over the voice of the community. And in Cancer Alley, corporations have the means to buy or bully residents into silence, even when data has been gathered against them. Despite the risks and vulnerability to co-optation that community science has, it shouldn't overshadow the real results that these partnerships have garnered in exposing cancer clusters, toxic waste dumping, pollution, and other concerns. Community science has the means not just to reestablish public trust in science, but it can also help build our trust in each other. Community science does more than allow us to imagine a world where science works for the people. It enables us to bring it to life.